Here is your question.
Yes, I'm ready.
All right. So if you have read and understood, considering it communication skill station, please begin.
Hello,
Yes, hello.
I'm Dr. Ali Bade, ST3, working for Mr. Man in Mumbai Hospital. I'm calling the vascular consultant to ask him to accept a refer patient with acute limb ischemia. Can I check that I'm calling the vascular consultant?
Yeah, it's me. Go ahead.
Okay, thank you for accepting my call. I have a lady for 54-year-old admitted 3 days ago, diagnosed as mild diverticulitis and on IV fluid and antibiotics. But now patient develop severe left lower limb pain unresponsive to analgesia. Patient is known to be hypertensive on antihypertensive drugs. On examination of the limb, there is a pallor and pulseless and pain. And on investigation, the ECG showed there is atrial fibrillation with the broad preventricular complex. And the ABG show metabolic acidosis. And the electrolyte showing there is hypokalemia. And the arterial duplex of the left lower leg showing there is ischemia. Based on this patient has acute limb ischemia. I recommend this patient need urgent transfer for early interventions to prevent patient limb loss.
Yeah, so you're telling me this patient is urgent because I have many things I will do today, or you will send tomorrow. Is it urgent, or you will send
Yes,
tomorrow?
okay, yes, this patient is urgent because this patient is acute limb ischemia and need early intervention to prevent patient limb loss.
Okay, I understand this. But why you suspect this limb ischemia?
First, based on clinical assessment, this patient has a pallor, pulseless, and severe pain. And on investigation, ECG showing there is atrial fibrillation. And the duplex of the affected limb showing there is acute ischemia.
Okay. So, do you think this patient need any cardiovascular consultation before you send to us? Because the ECG, there is abnormalities, right?
Okay, a patient need cardiovascular consultation, but the priority first for the limb ischemia. Then after refer, we can consult the cardiovascular doctor.
Yeah. Okay, I see. But can you tell me what do you think that this causes this patient arrhythmia and this atrial fibrillation?
Yes, arrhythmia may be due to the acute condition of the patient, may develop fluid loss leading to the hypokalemia. So the patient developed the atrial fibrillation.
Okay. So you told me that this patient have been diagnosed as diverticulitis, as mild diverticulitis.
Yes, yes.
So do you think that her presumed diagnosis of diverticulitis? Are you thinking
Uh,
of this?
yes, based on the current condition of the patient develop acute limb ischemia and have atrial fibrillation. This patient may have acute mesenteric ischemia.
Okay, okay. So what is your differential diagnosis regarding her abdominal this pain?
Yes. First, I consider this patient has acute mesenteric ischemia and the diverticulitis. Also, this patient may have pancreatitis, cholecystitis, perforated viscous or infective colitis, and also appendicitis.
Okay, so do you want to scan this abdomen first?
Now the patient abdomen is lax. I can't monitor the abdomen by serial abdominal examination. If patient is planned for surgery, we can do the other test. But this we can do all this after refer the patient.
Okay, so this could also be mesenteric ischemia, you told me?
Yes, it could be mesenteric ischemia.
Okay. So what imaging will you do for the abdomen, and what imaging you recommend for the limb?
For abdomen, if patient is planned for surgery, we can do CT angiography after checking the RFT renal function test of the patient. And also for the limb beside the arterial duplex, we can also do CT angiography.
Okay, okay. So how will you manage the atrial fibrillation?
First, I manage the patient with according to care of critical air surgical patient. I will manage underlying cause and give patient breath control, rhythm control, and anticoagulation.
Okay, and this anticoagulation, what type of anticoagulant will you use?
Yes, low molecular weight heparin or unfractionated heparins. The dose of the unfractionated heparins, it is 80 kilogram, 80 international unit per kilogram as a bolus dose, and then maintenance dose as 18 per kilogram per hours to adjust the ABTT between 40 and 60 seconds.
Okay, okay. So you told me earlier, you mentioned that you are going to correct the hypokalemia. How will you manage this hypokalemia?
I will give patient the potassium chloride 20 to 40 millimole in 1 liter normal saline. I will monitor the potassium with ECG and the serum potassium also.
Okay, and then what else will you do? What other management you want to look for other than the hypokalemia, atrial fibrillation, and the anticoagulant?
For the limb ischemia, the definite management, it may be surgical intervention or endovascular interventions. For the surgical intervention, I can do bypass or even amputations. For the for the endovascular, I can do embolectomy and thrombolysis.
Okay, okay. So if you are going to counsel her family, what will you tell about her condition?
Yes, I will counsel her family. This patient develops sudden reduction of circulation in the lower limb, and I will counsel them about the option of the management and the need of urgent transfer and the outcome of the patient and even complication for this condition.
Okay, okay. I think we can accept the patient, but
Yes.
I just want to ask you, how will you transfer this patient? What type of
Uh,
ambulance you will transfer?
yes, in the ambulance, critical care type, which she prepared with the CPR and infusion and sealing with infusion pump for cardioversion drugs.
Okay, okay. Okay, you
Yes.
can send the patient and give me feedback.
Yes, thank you, doctor. I will keep you update. I will transfer the patient. Thank you.
Okay,
Good,
okay.
thank you.